The big story tonight, of course, is COVID. And Florida has surpassed 4 million cases since the pandemic began. And CDC data indicates the state yesterday broke a single-day record with nearly 47,000 new cases. And cases keep rising across the country, and the number of hospitalizations and deaths are expected to keep going up. But still, the CDC is justifying its new recommendations for a shorter isolation period and the unnecessary requirement of a negative test at the end. Debra Alfarone has more on all of this now from the White House.
Just a day after U.S. COVID cases hit the highest one-day total of more than 400,000, the CDC is defending its decision to slash the recommended isolation period for those who test positive from 10 days to 5.
We are standing on the shoulders of 2 years of science. We know that after 5 days, people are much less likely to transmit the virus, and that masking further reduces that risk.
CDC Director Dr. Rochelle Walensky is also answering critics who've called for a negative COVID test requirement at the end of isolation.
We know a PCR test would not be viable because that PCR can stay positive for up to 12 weeks.
The FDA warns at-home rapid antigen tests may be less effective at detecting the more transmissible Omicron variant, though it still says people can use them. Federal testing sites are popping up in several states to meet increased demand. The Biden administration is sending medical personnel and equipment to hard-hit areas, and they're also urging all Americans to get the vaccine or a booster shot if eligible. Plans are underway for a smaller crowd at New York's New Year's Eve ball drop, while some cities such as Atlanta and San Francisco are canceling public New Year's Eve events. Here in Washington, the Smithsonian announced it will close several museums until January 3rd due to the increase in infections among staff. Debra Alfarone, CBS News, the White House.